food and ice cream. We have a number of great meal deals that include dessert at a better price than anyone in the industry. Our products are made fresh to order just for you. Dairy Queen Silver Springs, where we always treat you like kings and queens.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Well, not bad bumper music for a morning show. We're going to talk about cancer. It's a real serious topic. Can you imagine the day in the future? Let's say you're Rip Van Winkle or something. You sleep a really long time, and you wake up, and somebody says, "Oh, you got cancer," and you say, "Well, how long have I been asleep? Is there a cure yet?" And one of these days, there will be a yes to that answer to that question. Dr. Craig Reynolds and Dr. Luis Carrascosa are in the studio. They are here from Florida Cancer Specialists and Research Institute. We're going to tell you where that is. There's a ribbon cutting tomorrow, I think. I read somewhere. Yes. Dr. Reynolds is a recognized leader in clinical research, provides physician leadership on various committees and advisory boards, serves on the education committee of the American Society of Clinical Oncology. The credentials go on and on and on. Good morning, Dr. Reynolds. Nice to meet you.
Good morning.
And Dr. Luis Carrascosa, I hope I'm saying your name correctly. You are a board-certified radiation oncologist, held leadership positions, utilize precisely targeted radiation therapy techniques to treat all cancers. You specialize in breast, head, neck, lung, prostate, and skin cancers. You are fluent in both English and Spanish, and you provide the most advanced radiation oncology treatments. So it's an honor to have you in the studio, Dr. Carrascosa.
Thank you very much.
How did I do on your last name?
Oh, perfect.
Yeah? Okay. Yeah. Well, thank you both for coming in here. So tomorrow you have a ribbon cutting?
Yes, sir. We're very excited about it.
Are you open already?
We are already open. We started at the beginning of July, and tomorrow is going to be the official ribbon cutting ceremony. So we're already treating people.
So what is the, like when somebody finds out they have cancer, what is the answer to the question, am I going to live? Does it depend on the type of cancer?
Yeah, definitely. It depends on the type of cancer. Of course, that's going to be one of the scariest times in a person's life is to hear the big C word, the cancer word. So for us, it's really hard to see our patients that moment of being so scared and worried about it. So it has to be individualized. We have to look at different types of cancers, the types of cancers that are, and once you've had a official diagnosis, then we can start involving all of the specialties, all of the diagnostic tests, and ultimately then make a decision on what is the best treatment course for that particular person.
So forgive me if I ask like a really elementary question, but the two things we are familiar with are radiation and chemotherapy. Lately, we've been hearing about immunotherapy or something like that. Can you explain if that's new? Has that always been something we used?
No, that's something that's relatively new, Larry. And immunotherapy involves drugs that use the immune system to fight cancer. So one of the things we've learned in the last 10 to 15 years is that cancer hides from the immune system. So there are cells in our body called tumor-infiltrating lymphocytes. You can almost think of as Pac-Man going in and chewing up a cancer. And what cancers do is they express proteins that tells these guys, hey, it's okay. I'm supposed to be here. Just leave me alone. So the immune system just sits there. They don't do anything.
Wow.
And so what these drugs do is allow the cancer to no longer hide from the immune system, so the immune system can do its job. And it's really incredible when these drugs work. They don't work for everybody, and that's what we're studying now is why don't they work for everybody? So we're learning. It's complicated. Anytime you make a great advance, you generate 10 questions for every answer you find, and that's certainly the case for immunotherapy. And that's why we're continuing on with clinical trials, now looking at combinations of immunotherapy drugs so that we can advance this forward, because we're not going to be happy until all of our patients benefit from these drugs.
Wow. And you do more than just consult with the patients. You also are technically treating the whole family.
Well, that's right. A lot of what makes oncology, I think, different from other fields is, when I was doing internal medicine, I might vaguely know a little bit about my patient. When I'm an oncologist, I know when my patient's kids graduate high school. They know about my kids. It's different. They become part of your family
because
in a very real way.
You see them so often. And they're with you for a long time each time, right?
That's right, and the stakes are high, so it really builds that human bond in a way that I think is unique to oncology.
Do we lose time in treatment if we choose one or another? Like, let's say, oh, I want chemo, I don't want radiation, or do we lose time if we make that decision? I'd rather you guys make that decision.
No, I think this is we don't lose time. I think the important thing is about making sure that all of the specialties are given the chance to give an opinion, and have the patient make an informed decision. So after we present all of the different options, all of the different guidelines, or all of the different results, meet with the patient and help them make that decision.
Mm-hmm.
But we don't want to make that decision for them. We want to help them make that decision, because a lot of times there's many treatments that are going to be appropriate. For example, somebody's going to need surgery. They are probably going to need chemotherapy afterwards. They may need radiation afterwards. So it's not that just one treatment is going to be utilized. Sometimes it's a combination of treatments that needs to be done to be successful.
Yeah, so for example, Larry, for locally advanced lung cancer, so a patient who has lung cancer limited to their chest, but they can't have surgery. If we just give them radiation, we cure maybe 2% of those patients. If we give them chemotherapy alone, we cure 0% of those patients. If we give them chemotherapy and radiation together, we cure about a third of those patients. Not great, but better. The new thing is now we give them immunotherapy for a year after the chemo radiation. We don't know exactly because it's still early days, but it looks like that cure rate is going to be close to 50%. So a lot of times it's not an either-or choice. It's using a lot of these modalities together.
And the Ocala Cancer Center is not just a building. You took great care to speak with your patients to see what kind of an environment that would be most conducive to them and their treatments.
That's exactly right. So Florida Cancer Specialists has built these buildings in other places, and there's some data about color schemes and things like that make people feel better, and it's less threatening. And every time you build one of these, you learn a little bit. So the fact that this is not the first building, we learned, benefited from the experience from the previous efforts. And then we did have a patient advisory committee that actually came in and gave a lot of really valuable input from a patient perspective, which obviously is very important, about how to make the building better.
And do you treat all ages?
We treat mainly adults. We do not treat the pediatric cancers, but we treat all other ages with either chemotherapy, immunotherapy, or radiation at our center.
So we went looking on the internet to find out where you are located, and the GPS did not do it right. And I'm pretty confident with GPS normally, but this time it got it wrong. But you are really near the West, what's it called, the West Community?
Yeah, we're right next to West Marion Community Hospital. So if you were driving from I-75 west on State Road 200, you would actually pass the hospital, make a right-hand turn where Bonefish Grill is, and then we're back behind there on the left. It's hard to miss because it's a huge building.
So I'm just curious about targeted radiation. I don't know if you both did that or one.
That is my specialty. So I'm a radiation oncologist, and what the nice thing that we have is that we have the latest equipment that allows us to deliver very safe and precise doses of radiation. But it's not just about the equipment. So we have fantastic equipment, but more importantly, we have a fantastic team. And so it's not only the physicians, but we have a PhD physicist, we have certified medical dosimetrists, certified radiation therapists, and oncology nurses. So that bringing that team with the equipment allows us to do very precise treatment. So nowadays, there's a lot of misconceptions and myths about radiation throughout the years. Yeah. But radiation therapy has never been safer and easier to deliver than in present age. So what we now have the ability that we can, on a daily basis, see exactly where the tumor is located on that particular day and track it directly. So for example, if a patient is breathing, a tumor is going to move, and we have the precise ability to track that movement every single day. We have other different mechanisms that we can protect, for example, the heart. When we're treating the breast in our patients, we have different techniques, either controlling the breathing pattern or having them laying down on their stomach, we can protect the heart completely. So those are things that are revolutionary. They're new. They're the standard of care. So we are very happy to bring that to Ocala.
And everything is in-house.
That's right. So, in addition to chemotherapy and radiation therapy, we also have in-house imaging and in-house pathology, as well as a really good pharmacy for some of these new oral drugs that are incredibly expensive. And the big advantage of these in-house services is our pathologists and our radiologists, first of all, only do oncology-related things. And they can look in the patient chart because they're part of our practice. Mm-hmm. And that gives them makes their job a lot easier because they're not just looking at slides or looking at x-rays. They can understand what's going on with the patient clinically and what the questions are and give us much better information so we can do a better job at what we do.
I have a question. I don't know if I'm going to ask this correctly, but when you hear about prostate cancer and then you hear about breast cancer, you always think about that body part that has the cancer. And then we understand that it how do you say the word? Metastasizes, and that's a scary thing because then it gets everywhere. But how do you treat something like leukemia that it's like the whole body, or you know what I mean? Or does a metastasized cancer sort of behave like leukemia?
In some ways. So some of our treatments are localized and then some are systemic. And what's interesting is as our systemic therapies are becoming better, we're now sometimes using radiation, for example, to a single area. So one of the things we've learned with the immunotherapy drugs, for example, is a patient will have excellent disease control. So here's someone who had metastatic, say, kidney cancer everywhere. And it's under great control on immunotherapy, something we never saw when I started as an oncology doctor. Really? And then one spot will start growing. So what we've learned now is to just radiate that one spot. And a lot of times that'll do the trick for the patient for a long time.
Really?
So we never did that in the old days. You'd think you were crazy to do that. So the rules are changing as our care is improving.
So when we hear about new treatments, new discoveries, do they happen every day? And do they happen in your facility? Like, could you say, oh my gosh, look what I'm noticing, and then make a report to the rest of the medical community?
Yeah, and one of the things we do at FCS is participate in clinical trials through the Sarah Cannon Research Institute, which is one of the leading research programs, not just in America, but in the world. It's an international program now. And, we have phase 1, which is first in human trials, phase 2 and phase 3. And if you look at these wonder drugs that have been approved over the last 10 years, FCS's research program has been involved in the clinical trials that led to the approval of most of these drugs. So our patients, through our research program, get access not to what's standard of care today, but sometimes to what's standard of care tomorrow, which is very exciting.
Wow, that is cool.
And Dr. Carrascosa, how long does it take your general physician to diagnose their patient and then them to refer them to you?
Well, it depends on the situation, but as soon as their primary doctor has made a diagnosis or they have a mammogram and they get referred to us, we try to see those patients immediately, as quickly as possible. Once a diagnosis is made, it's for our job to get them in as quickly as possible. And the nice thing nowadays is that with radiation, sometimes radiation it's used on its own, sometimes radiation is used in combination with chemotherapy or immunotherapy, but we are using shorter radiation treatment schedules. With the technology that we have and the newest trials results, we can treat people sometimes in 1 day or in just a few days. The longer radiation treatment schedules are not as common anymore. We are making it a lot more convenient for people, and this is not just here. This is all around the country. This is the standard of care around the country. So we're very happy that they can spend more time with their families, doing the things that they like, rather than being visiting us that often.
The fact that you are a research institute, does that mean that there are more clinical trials there than there might be, for example, at a hospital?
Yeah, and there have been times where we have clinical trials that are better than what's available at university centers. It just depends on the nature of the trials. And, Sarah Cannon has done a great job of really getting us access to the best trials for our patients. So, the first thing I do when I see a patient with a new diagnosis of cancer is look at my list of trials to see if I have a clinical trial to talk to them about.
Really? And the type of cancer might help you understand which trial would work best?
That's right. So most of our trials are disease specific. sometimes they are mutation specific. So we've learned there are certain clinical characteristics or biological characteristics of cancer that are more important than the actual where the cancer started. So we actually sometimes have trials that are looking at a specific mutation in a cancer. That it doesn't matter where the cancer started. If it has that mutation, then they're eligible for that trial.
Do you still give a diagnosis of length of life to the patients?
That is a very good question. I don't know about Dr. Reynolds, but particularly for some cancers, I have stopped giving life estimates because now it's off the charts. Particularly, for example, lung cancer. People that we used to see only live 6-8 months. Now we see people 3, 4, 5 years later, and they're still doing well. So it's very difficult, in my opinion, nowadays to give some life estimates, particularly in certain disease sites like lung. And so we try to be very careful about that. There's very exciting times.
That's a tough call anyway for any doctor with any disease.
Absolutely.
If you think about it. Dr. Craig Reynolds and Dr. Luis Carrascosa are in the studio with us. They're from the Florida Cancer Specialists and Research Institute here in Ocala. If you have any questions for them, do you want to take phone calls from listeners?
Sure.
You are welcome to call. The number is 622-9622. I have a question about vaccines. We've had doctors on who wrote books who told us about vaccines for like cervical cancer. Why are there no vaccines for the other cancers?
They've been studied and they've been tried. And unfortunately, although there's been a signal of maybe a little bit of benefit, it hasn't been enough to really make a difference for our patients. And the immunotherapy drugs are kind of attacking that mechanism the same way. And one of the areas we're just starting now is looking, maybe going back to some of those vaccines that failed and combining them with the immunotherapy drugs to see if that makes a difference. But immunotherapy works a lot of times through prevention. So, for example, the HPV vaccine is incredibly effective at preventing cervical cancer. So that's something that young kids get vaccinated for, and head and neck cancer, and probably some other cancers that we haven't figured out yet.
Wow.
So that's why, standard for both boys and girls, in their teenage years is to get vaccinated against HPV.
And a diagnosis of cancer does come as a shock. My friend Ronnie went in 8 years ago to his general practitioner. He thought he had a cold, developing into pneumonia, and turned out he had lung cancer. And then he went, and then they removed his left lung, and now he's been a cancer survivor for 7 years.
That's fantastic.
So it can be tricky.
He's doing
you
wonderful,
don't know.
too.
Yeah, but early, finding the disease early is the best chances. So if you find it early, patients can have surgery, or we treat them with radiation. And if I'm talking about lung cancer specifically, those patients can be cured if you catch it at an early stage.
Is there anything the community at large can do for you? Can we help you in any way? Do you need donations of something?
No, don't smoke is the best way to avoid coming to see. It's great to have this facility in Ocala, but I think everybody who lives here loves that it's here, but hopes they never need to use it. And certainly not smoking would help. We do have something called the FCS Foundation, which is set up to help cancer patients pay for non-medical parts of their treatment.
Okay.
That's not unique to FCS patients, so any patient in the state of Florida is eligible to get a grant from the foundation. Does incredible work. We had a big fundraiser last year, and we plan to have another one next year. So certainly donating to the FCS Foundation is a way to help
Keep
cancer
us in the loop
patients
when you do
everywhere.
that one, so we can help you.
Okay.
Absolutely.
When you do your ribbon cutting tomorrow, is the general public invited, and will you be giving tours?
Yes to both of those. So the ribbon cutting is tomorrow at 8 in the morning. We have several local dignitaries who will be there besides the staff, and we will have tours. So it's a great opportunity to come and see a state-of-the-art facility. One of my patients, when it first opened, told me it was like a spaceship came and dropped it in Ocala. He was so surprised at what it was.
It is amazing how we're growing as a city. It's just everywhere you look, something else is happening.
Yes.
But I think in our opinion, you doctors and your staff are the dignitaries, because you are actually helping save lives and keeping families together.
I think the patients are the dignitaries. I mean, because what they're going through and understanding all of how it affects the family and the individual. I think that they are the ones that make us work harder every day and try to make things better for them, because we can see those people feeling better, giving them some quality of life, some hope, and sometimes it's a cure. So, that makes us happy. Yeah, that's simple human courage that we see in our patients, in the worst of times, is inspiring to all of us, and that's what keeps us going in oncology.
So you mentioned no smoking, and so that's a lifestyle choice. What about emotional choice, like to be happy, that kind of thing? We always hear that's helpful. I don't know. What do you think about that?
Yeah, it's been hard to show a link between stress and cancer in humans. Certainly, in animals, we know stress can cause cancer. So, for example, if you have an aquarium and you transport marine fish, they do it in the dark, because if you do it in the light, they get stressed and they actually develop tumors from stress.
Oh, my.
Wow.
So in human beings, certainly if we could remove stress from our lives, it would probably be good for us. If anyone in the audience knows how to do that, I'll buy the book. I
have an idea. Watch funny dog videos. Whenever I get stressed out, I watch those YouTube videos of dogs chasing each other, and I just feel better.
How do you gentlemen keep your objectivity, because this has got to be very emotional for you?
Yeah, it is hard. In being oncologist, it's hard, but I think that we need to keep our eye on the target, and the target is helping our patients. I try not to get too emotionally involved, and by that I don't mean that I'm cold. I mean I really care about my patients, but we need to focus. We need to help them understand. If I can teach them and show them compassion and show them what I'm doing, they understand what they're getting themselves into, and they feel a lot more comfortable. But yes, I'm not going to lie to you. There's difficult days, but the good days are more and more. So,
Dr. Carrascosa, you said earlier that there are a lot of misunderstandings about radiation treatment.
Yes.
Is one of them that if you give me radiation, it's going to cause cancer? Is that something people think?
That is one. That is one of the fears. But there's a lot of fears, maybe even based on older radiation technology and older things that happened many years ago. But people don't glow in the dark. People are not going to be a risk to a family member, except on some very specific other types of treatments, but people are not radioactive. They can go about their normal daily routine. Radiation doesn't hurt. Radiation doesn't cause a lot of problems. It's very safe to do it. So those are some of the things that we're doing, not just here. I mean, there's a big movement from the radiation oncology community to get the word out about modern, safe radiation therapy techniques. That's what we're bringing now, and that's what we're trying to.
Does diet help at all? Or just if we change, like you mentioned, smoking is bad. Are there things we can put in our mouths that are good for as far as preventing cancer?
Yeah, I think in general, diet does seem to be important. It's basically what you tell your kids. Eat lots of fruits and vegetables. Don't eat a lot of junk. It's easy to say that. It's a little bit harder to live it sometimes, and you got to live a little bit. But Ben Franklin always talked about moderation and everything, and I think making those basic changes is important. People like to take vitamins, but all of the data looking at cancer and vitamins has been negative, or actually show that they're harmful. But the foods.
Oh no, really?
Yeah, but the foods are important. So
getting vitamins naturally is the way to go.
Exactly.
If a woman is in her childbearing years and she's diagnosed with any type of cancer and that cancer is cured, can she still have children? In general, the answer to that is yes. And one of the highlights of my career in medicine years ago, I had a young woman with Hodgkin's disease, and she was very, very ill at the time. And fortunately, she was a survivor. And one day she just came by because she was visiting her mother, and she had her kids there. And she came in and said, "This is why you have a mom and you're here." And it was really just a cool moment for me.
I'm amazed at what you both have chosen to do. Thank you for coming in here to share this with us. Good luck with everything. Tomorrow's the ribbon cutting.
Yes.
What time is that?
8 o'clock in the morning.
8 o'clock. And everybody else, let's give out phone numbers so people can call you if they need to. Or you don't know it?
We have flcancer.com as the website with everything on it, and it is at 4945 Southwest 49th Place in Ocala, Florida Cancer Specialists and Research Institute, Ocala Cancer Center.
Yeah, and our Ocala main office phone number is 352-369-0181.
I'm guessing most of the patients you see are referred by family doctors, that kind of thing, right?
Most of the time, but we do have patients who self-refer themselves because they, look around on the internet and figure out the best place to go for their care.
Yeah, well, there's a whole, we could spend a half hour talking about the internet with cancer research, right? Yep. Thank you both for what you do and for coming in here to talk to us about this.
Thank you.
Thank you.
All right, and if you want to share this with anybody, we have recorded it. We'll put it up on YouTube and Facebook, and it'll be ready by 2 o'clock today. Thank you, guys. We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Nothing should come between you and your money. So we're introducing zero account fees with zero minimums to open an account. All because we want you to invest with zero trade-offs. Visit fidelity.com/value to learn more. Zero account minimums and zero account fees apply to retail brokerage accounts only. Expenses charged by investments such as funds and managed accounts and for commissions, interest charges, or other expenses for transactions may still apply. Fidelity Brokerage Services, member NYSE, SIPC.
Pros do it right to have the quantities you need on hand for the job by buying in bulk. Lowe's is here to help by stocking what you need for any size job and at